nursing philosophy presentation is titled Health Goal. So my painting, as you can see, is basically a nurse and a patient creating a bridge with their arms, and on that bridge, the patient is, at one point the patient is sick. She's using crutches, has a broken leg. At another point, the patient is seemingly better, but not yet at that health goal, but is a little bit better. So basically what's going on is the patient and the nurse are both working together to get that patient to the goal, which is health. And as the patient gets closer to the goal, they need less and less help from the nurse. That's symbolizing the patient getting better. So basically, my nursing philosophy is centered around goal attainment, which comprises the nurse and the patient creating goals together that will lead the patient to better health. So working together is something that is heavily emphasized in my nursing philosophy, as well as the patient gaining more independence as they get better. So my philosophy relates to nursing because nursing is a process that never really stops. And in relation to the goal attainment theory, the nurse and the patient, they're both partners and they're constantly working together. They design goals and they figure out how the goals are going to be reached. The nurse and patient both work off of each other to modify the plan that they need to achieve the goals. And so my philosophy relates to person because basically what defines us as people is our ability to think rationally and to communicate with each other, right? So communication is very important for goal attainment because the nurse and patient both must clearly understand what each of them wants and needs in order to reach the goal of better health. So relating to environment can basically kind of be two meanings. You have the external and the internal environment, and that's when relating to my personal philosophy. So the external environment basically includes anywhere that the nurse and patient interact. This can be a place like a hospital, a rehab facility, or even like a doctor's office. The external environment will greatly affect the relationship between the nurse and patient, which will subsequently affect how the goals are reached. Because say at a doctor's office, the nurse and patient might communicate a lot less than in hospital. And the internal environment, that's relating to the patient and how they feel and think. This internal environment is important because the patient and the nurse must be on the same page mentally in order to achieve the goals that they both work together to outline. Now, relating to health, basically health can include the physical state, your mental state, as well as your emotional state. Health is kind of a dynamic life experience, and this is in the way that it's always changing throughout our entire lives. This is because your body is constantly trying to maintain homeostasis so you can be in good health. So good health, you can kind of define that in a lot of different ways, but the way that I'm defining it is being free of illness and disease. That's kind of the most basic way to define it. And my nursing philosophy kind of defines it as having reached those goals that the patient and nurse work together and set, reaching those goals and no longer needing that nurse assistance. So that's the patient being healthy, free of whatever illness, disease they had, and not needing any assistance. So gaining back that independence that they have. Okay, and my nursing theory is based off of Imogen King's theory of goal attainment. And basically this goal attainment theory, it shaped my nursing philosophy because it focuses on the patient and the nurse working together by communicating, setting goals, and taking actions to achieve those goals. The theory of goal attainment also focuses on the action, reaction, and interactions of the nurse and the patient. For the goals to properly be reached, both the nurse and the patient must continuously share with each other their thoughts and perceptions on how the situation is going. So if they both think it's going good, the patient's getting better, or the patient might think that they're not getting better, they need to communicate that with the nurse so they can revise their plan and their goals. This constant communication is what's going to allow the patient to understand their treatment and how well it's going, as well as allowing the nurse to effectively assess the patient and how well they're progressing towards the goals that they both set. that's it for my nursing philosophy project.